Good afternoon, everyone, and thank you for joining us today. I'm Shriyal Sethumadhavan, the Executive Editor of IDEX Healthcare, and I welcome you all to the IDEX Healthcare Digital Series. To give you an introduction to what we do and who we are, IDEX Healthcare, a division of IX Events, has been creating thought leadership platforms for the global healthcare and pharmaceutical communities. Over the last decade, our events such as Hospital Planning and Infrastructure Exhibition and Summit, Clinical Trials Congress, Pharmaceutical Outsourcing Congress, Aesthetic Medicine Magazine and Events, CIPI, that is Cosmetic Ingredients and Packaging India, have brought together thousands of healthcare and pharmaceutical professionals from around the country and the globe to network, to share the latest in ideas and research and do business. For our webinar today, Mr. Neel Mehta has joined us to discuss the need and how can you integrate robust healthcare technologies and systems at your workplaces. Welcome, Mr. Mehta, and thank you for joining us today.
Thank you for having me. Good afternoon, everyone.
Good afternoon. So, in the current public health crisis, there is an immense need to not only upgrade existing healthcare infrastructure, but to also integrate telemedicine and personal and home healthcare technologies into the broader healthcare framework. This would certainly help organizations support the health and welfare of their employees. And with workplaces reopening up, how can organizations ensure their staff is healthy? Mr. Mehta will tell us today. I'm delighted to introduce him with a few more words. Mr. Neel Mehta leads the technology platform deployments and futuristic health projects across the Adani Group, the second largest conglomerate in India. He is an award-winning healthcare futurist, co-chair of the MedTech Committee at the AZ Tech Council, and business mentor with the entrepreneurship cell of NIT Trichy. He is an empathy-driven medtech innovator, multifaceted and serial entrepreneur, and biomedical informaticist with over 8 years of experience in digital health, leadership, and healthcare innovation. While I thank Mr. Mehta once again for joining us on this session today, for all our attendees, I have a small instruction to add in over there before he takes over. You would see at the bottom of your screen, you would have two options, the Q&A box and the chat box. So if you have any questions for Mr. Mehta today, for our speaker, please key them into the Q&A box and we will take them up at the end of the session. And you could use the chat box to communicate with us with IDEX Healthcare for any feedback that you would have for us or any topics that you suggest we cover as part of IDEX Healthcare in our upcoming digital series. So the Q&A box is for questions to Mr. Mehta and the chat box is for your feedback to us. And with that, over to you, Mr. Mehta.
Thank you, Shriyal. Thank you, IDEX Healthcare and the team and everyone who has joined us live this afternoon. Thank you for having us. And so without further ado, allow me to share my screen so that we can kick off this process. So am I audible and can you see my screen?
Yes, we can.
All right. So we are here gathered this afternoon so that we can learn more about how employers as well as employees can, transform themselves during this post-COVID-19 or post-COVID-19 era where the offices and the workplaces are getting back to normal. And then how we can integrate healthcare technology systems so that we can provide, support services, clinical services to our employees at scale. So real quick, let me see. Yep, there we go. Okay, so as Shriyal mentioned about my background, I'm with Adani Enterprises Limited. And along with that, I'm a health expert at Clarity.fm. And I do speaking, consulting, as well as mentoring on my own as an independent consultant. And over the past 8 years, I've been honored and grateful to have received several recognitions. So, as we all are aware about COVID-19, and don't worry guys, I won't tell you each and everything that how the virus started from Wuhan, China. We'll fast forward to date and then we'll talk about the future. That what are the practices which are changing? So first of all, we all know that healthcare workers have been completely taken a toll. That means they are tired, they are fatigued. A lot of physicians as well as nurses are now testing COVID-19 positive as a part of hospital acquired infection. And so those practices, seeing like one patient, one nurse, one doctor at a time, is making it difficult to serve this pandemic crisis. And because of that, the trust factor is going away. A lot of people as well as employees in corporate environment are not comfortable going to government hospitals to seek and receive the treatment for COVID-19 because they have fear that a proper treatment protocols will not be followed. So all of these things leads to one of the major objective. The goal of today, this afternoon, is to create a robust, digitally savvy healthcare ecosystem. And the way we can do it, but before that we can start, I just wanted to share a real quick about what is digital health. We all talk about healthcare technology, medical technology, so on and so forth. So we keep changing these words as and when during our conversations, during our presentation. But each of these words have definitive and different meaning and a different perspective when put into picture. So one of the things about digital health is, how you are able to do it using the integration of mobile health as well as HIT, which is healthcare information technology, along with wearables, sensors, and medical devices. So when you put all of these things together with a single objective to provide an effective clinical care to your patient population through this use of robust medical technologies, that is known as digital health. So as we move forward, we all know that we live in a world where everything is evolving and changing at a lightning speed, and technology is not alone. Technology is changing healthcare, especially as well. And so where it is going, we can see that it is being applied, and we can apply technology in different places, all the way from virtual and augmented reality, advanced monitoring, AI-based, machine learning-based wearables, and Internet of Things. So all these things which we have at our fingertip, but we don't know how, when, and why to use it. So moving forward, one of the things which many of you are aware about is Maslow's hierarchy of needs. We human beings kind of fit into this 5 equations, which was discovered and proven by a scientist called Maslow. And what he says that one of the quick things about human beings is, first of all, we have to fulfill our very bottom layer according to the triangle, is the basic necessities of our life, which is water, food, air, and safety. And so once we achieve this, in COVID-19, we realize that how much this essential services as well as food, water, milk, medicines matter to us. And through that, we came to a realization that we were not able to, do something which was creative, which was self-actualization while we were struggling to make our ends meet. So wellness at workplace, or providing a good clinical system at workplaces, begins with the higher level of actualization, which is the top of the pyramid, where you build the self-esteem, the confidence, the achievement, the good morale for your employees. And the way as an employer you are able to do it, or as an employee you are able to orchestrate, will follow in the coming slides. As you can see that there are innumerable benefits of providing well-being programs at workplace, both quantitatively as well as qualitatively. So we will look at some of the examples which I have shared in this presentation, in the slides this afternoon. Is number one, we improve employee health behaviors. When they feel comfortable, where they feel that, okay, all the standard protocols have been followed, especially after this COVID-19, as and when, like starting today, all the offices must resume with minimum 50% attendance, especially in the state of Gujarat and other states, where now employees are going back to the workplaces as well as to their academic or industrial work settings. And many of them are afraid whether if they will go there, whether, whether or not they will be infected or they will contract COVID-19. And so when employers will take measures which are very acute in a way, to check the Arogya Setu app, to check the temperature, to make sure that everyone is is wearing mask, wearing gloves, wearing full size clothes, so that the infection is not contracted on the skin, having eyeglasses to protect your eyes, or wearing a face shield. All those minimal, simple things matters a lot. And again, those are not technical aspect, but those are the things which will create that safety among the workers as well as your employees, and which will create an improved health behavior, right? And on the top of it, you can provide some of the mobile based technological clinical systems to aid into this process. The second aspect is reduce elevated health risk. Having lifestyle programs such as obesity prevention management program, that is related to the weight. You can have something where you keep your employees together in the form of yoga, diet planning, nutrition, and providing healthy meals at workplaces. Those things goes into reducing the overall risk for your employees as well as for your colleagues. And then because of all of this, overall, it reduces the healthcare cost. I'll talk about an example at how Adani we have deployed all of this step by step down the road, and how it is, how we are able to reduce our healthcare costs and reduce our premiums with the insurance companies as well as with the third party TPAs which we are working with. And of course, it improves the productivity. Our employees feel much more, motivated. They reach to a pyramid, which I talked about, Maslow's hierarchies of need, towards the top level, which is called the self-actualization. So they are able to work more productively, and it results into an increased and efficient output in terms of their projects. And then also it can help with respect to employee recruitment. Nowadays, employees are always seeking where they want to get the next job. Whether the employer has the gym, they have the place to go for an afternoon walk after a heavy meal, or whether they have the flexible working hours, which is the need of the time, as well as so many other things that taken into consideration, along with, of course, what they are going to, make at that workplace. So all these things, the ancillary things, the supplementary things, matters a lot for a well-informed employee who seeks good benefits for his or her own health. And then down the road, it also decreases absenteeism. Most of the employers provide 7 to 10 days of sick leaves, throughout the year. But focusing on the employees' health, providing them with good meals, no diet soda and no diet Coke and all that, things which reduce the immunity, rather boosting immunity, such as giving immunity boosters, through natural and through clinical efficient methods, increases the presenteeism. Employees don't want to just take sick leaves if they feel that, okay, they have been well taken care at their workplaces. And last but not the least, which is the real crux of this presentation, is to build and help sustain high employee morale. After COVID-19, employees are afraid, they have fear, there's a lot of stigma associated with it. And the only way we can overcome is by following some of the standard practices to improve the health and well-being of our employees at workplaces. So as an employer, if you are in the HR, or if you are in the position where you can participate in providing or bringing about a positive change in your organization or at your workplaces or at an industry, these are the top 3 things which you should keep in mind. Is one of the things is meet employees where they are. Days are gone when you can tell your employee, hey, you are having cough and cold, hey, go down 5 kilometers away, and we have a hospital tie-up or a clinic tie-up there, and you will see a doctor there. Employee is not going to spend half a day take half a day off from work and do that. Rather, they will just take one or two other medications which they have been taking care of, and will think that, okay, this will go away. The flu will go away, the cough will go away, the fever will go away. So rather than doing that, why not implement telemedicine? Why not have a specialist, or a primary care doctor, or a physician who has an experience in industrial health at your workplace, at the location, at the site. And by having that, an employee can just walk down the road or walk across the building and seek proper guided clinical treatment. The second thing is, as an HR or a medical professional, you have to make sure that they are following the right care pathway, with multiple views coming from all different directions, right, all the way from Google to your to employer's doctor, to the corporate doctor, to a specialist, to some of the online telemedicine software solutions where they can consult with other doctors. An employee can get mixed guidance with respect to how they have to take care of this condition or the sickness which they might be facing through. So, as an employer, or, as a healthcare provider, you have to make sure that it's the right care pathway. It's best suited for that particular employee. And you can achieve all of this through efficient, consistent, and easy processes, which we'll also share as we go forward. So now, this is one of the things you might be wondering, okay, this guy is just talking about well-being and workplaces, how I can deploy, what can I do at my workplace if I have that ownership, or if I can share my viewpoint to my employer, to my boss, or to my group, or with my colleagues as well. So on the left, you can see all the digital health technologies which are being deployed, which are being available in the current marketplace. And on the right, you can see some of the things which this digital health platforms are able to resolve it. So for example, if we take telemedicine, which is on the left, and map it across the right, you will be able to see that it is able to do the diagnosis. It also is able to do the treatment. We are able to monitor those patients at home. It also helps with like protecting the healthcare workers on site at remote locations, so on and so forth. And then you can start deploying more and more tools and technologies based on the demand, or based on the need at your workplaces. You first have to create something which we all are aware about, is scope document. What is my requirement? Let's say if I have 100 employees, what are the things which I should have? If I have like 1,000 employees, what else should I add on the top of it? If there are like 10,000 employees at your group, then what else you can do that? If they are segregated, that means they are within different cities, within different states, some in India, some abroad, what are the platforms through which you are able to provide a comprehensive, consistent, systematic care? So that becomes very essential. And then the list just goes on with AI, electronic medical records, cybersecurity, chatbots, and so on and so forth. So, over the past like 1 year of the research of like just understanding what are the employee wellness provider companies across the world, which have taken the initiative to support groups like Adani, groups like other conglomerates in India, and we are able to deploy or implement the solutions. So I've had like some chance to review, research, do deep dive into the wellness aspect. And these are some of the top 10 companies which I came across. So you can take a note of it. Trust me, I'm not affiliated with any of them. This is not a sales pitch, but this is something which you can like start Googling and start learning more about what are the features, what are the modules that they are offering, so that you can start learning, you can start seeing, okay, that these are the things which you should provide at the workplaces in this like post-COVID-19 era. And then these are some of the leading digital health companies in India. Again, I'm not affiliated with any of these companies. These are just some of the companies which have understood over the research for the past 1 year at Adani, and then having conversations, collaborations, learning more about the proposals, the platforms, the technologies, and so on and so forth. So you can see it's like not one size fits all, not just like one company will work for your group, not just like, two companies will work for the group, not just like one solution will meet all the requirements of your employees. So you really need to put everything together to understand, okay, what is the best way to pass it forward. And then, but the challenge is, our core problem is not the lack of innovation. We have so many tools, platforms, technologies across like digital, like the moment you pick up the smartphone, you have more than 97,000 apps, which are one way or the other way related to wellness, related to activities, related to like walking, tracking your heartbeats, tracking diabetes, like the glucose level for diabetes, taking your blood pressure for hypertension, so on and so forth. So that's not the problem. We are all pioneers who have gathered in this room this afternoon because we believe in innovation. We eat, sleep, breathe breakthroughs in innovations, right? But at the same time, the challenge is the human inertia. We really don't want to change, or our group, our workplaces don't want to evolve. We are set in our own ways. For example, if we are doing this for the past 10 years, we just want to keep doing that same thing over the next 15 years, unless, it's a dire need or an emergency situation. Like, for example, so many of the groups and the companies always had the culture of like walking into the office, working from 9 to 6, 8 to 5, or 10 to 7, whatever your time is, and then going home, right? It's like the physical presence at the work will count that you are working. But with the onset of COVID-19, a lot of businesses have to change their processes to make sure that they have business continuity process, right? The BCP, you would have heard about this word over and over again. And those companies took a transformative step of like providing laptops, desktop at homes to all these employees. Most of the employees like moved back to the hometowns from where they came to work at that particular cities. And now the companies are able to do it. For example, Google said that, okay, our employees will work from home or wherever for the entire 2020. So for the next 7 months, they'll be working along with the last 2 months that they already have been working, right? So the companies are able to take those steps when this urgency, when this change is required. So I say that COVID-19 is the best digital transformation officer one could ever had. It's a joke, but because of COVID-19, everything is moving digital, and people are seeking and finding the ways to make it possible. So then my question, think about this for a second. We are able to do it for workplaces. We are able to do it for banking. We are able to do it for the digital retail and with, the food deliveries and so on and so forth. Then why not for healthcare? Healthcare is one of the basic necessity which all us as human beings need at any given point in our lifetime. So, but as I mentioned, with the onset of COVID-19, necessity is becoming the mother of inventions. We are able to now leverage some of the things at our workplaces, at hospitals and other places. And so the need for the digital health portable technology is key. So if you are into this, or if you want to study more about, that is something, an area of interest which you can pursue. So last but not the least, employers must do this 4 different things, that is like move beyond the traditional model of providing basic dispensary only, right? Days are gone when you can just like set up like one room at your workplaces and say, hey, I'll have a doctor who will come from 9 to 11, like 2 hours a day, and then that's it, a doctor, and then an employee will go. An employee wants to care at any given time. Sometimes, they are working throughout the day and they are only available to seek medical or clinical interventions in the night time. So you have to meet where the employees are. Second, incorporate experiential learning. What I mean by that is days are gone when you can just do one-on-one learning, right? An HR manager or a boss sits down with his or her employee and teaches them all the things that they have learned over the past like 10 years, 15 years, and that doesn't work. Now you have to create the learning modules in a way that can be delivered at scale to multiple employees, to multiple businesses all at once through digital platforms. And then, ensure that all the products and services enable coordinated employee-centered care. That means putting employees at the center. With all this like COVID-19, there have been a lot of like layoffs and furloughs and everything. But, as an employer, if you are, if you have like best practices, if you are putting your employees' health and safety first and making sure that you take care of them, I'm pretty confident that, they will take care of you. It will come back. And so, with these demanding times and the challenging situations, make sure that you take care of your employees and your colleagues as well, if you're an employee, and create a good ecosystem around you, which will result into a holistic wellness ecosystem at workplaces. And all of us will thrive and grow together. So before we conclude, I just wanted to end this with an example at how Adani we did it. So we built an employee-doctor relationship where we are empowering our employees, like more than 15,000 employees across 22 different businesses across pan-India, to be able to connect with a doctor at their fingertip 24/7, 365 for any queries, all the way from physical queries, physical health related questions to mental health related questions, so on and so forth. The second thing is we are able to now put the employees' health insurance coverage on the dashboard. So we are creating a personalized dashboards for all of our employees so that they know, okay, what are the things that they can avail as a part of like the employee benefit in terms of hospitalization, medical visits, the medicines, so on and so forth. The third thing is about lifestyle interventions, shred fit, go fit. Shred Fat Go Fit was one of our campaign which we did to reduce obesity among our employees. What we found out that managers and above usually have a high-paced, fast-paced, high pressure, fast-paced lifestyle, and so because of that, they are prone to gain weight and increase obesity. And so for them, we create a personalized concierge wellness program and offering, which included all the spectrums of the healthcare, right from diet, which is the nutrition consulting, to yoga, to physical therapy, to clinical interventions, as well as the daily monitoring. So that is the more like a comprehensive care which you can provide to your employees while making sure that their work, their projects, their family life is not getting affected. So you have to walk that like really fine balance to be able to do it. You cannot say your employee, hey, come to work like 3 hours before your day actually begins, and then for the 3 hours we'll teach you X, Y, and Z. None of the employees are going to do that, because anyways they're spending 9 to 11 hours at work. They want some time with their family or with their friends or with their brothers and sisters, with their significant other. So how you are able to do it, and you cannot tell your employee, hey, in the afternoon when you're working, come for 2 hours in the meditation room or in the yoga room and we'll teach you this and that, right? Their boss will be mad at them if they don't complete the projects on time. So again, you have to, it should not be like completely on the left side, and it should not be completely on the right side. So finding that right balance, a good ecological system and a good ecosystem helps. And then we do remote site monitoring, especially we have some of the employees where they are working, where there is no network, no internet connectivity. So rather than going the traditional digital platform route, in terms of providing a telemedicine solution, what we did is we created a text-based, clinical intervention where with like 1, 2, 3, 4, 5, 6, 7, and 9, we give 9 different options, and the employee is able to communicate with our physician or with our nurses on site or off site, with COVID-19, and they are able to share what they are facing through and have an informed decision what they can avail and take at that any given point in time. And finally, a knowledge base where our employees are able to go and learn more about, what is congestive heart failure, what is diabetes, what is blood pressure, what is like a knee transplant. So creating a well-informed awareness group and empowering our employees again to take ownership of their health goes a long way. Now employees feel confident that, okay, if something happens to them, their employer, the team members are there to take care of them. And so we were not able to achieve that through in-house. We started that, okay, we'll build an in-house tool which will cater all of our requirements for our employees pan-India level. And we figured out, okay, it cannot be. So then we started scoping out all different vendors which are out there in the marketplace. And we realized that not one vendor meets all of our requirements. So what we did is we partnered with like 2 vendors. We built our own, we had our own IT team who also came in, our own healthcare team, our HR team. Everyone came together. That I call collective collaboration. Everyone came together with one single emphasis, one single focus, which is putting employees at the center, taking good care of their health, using all the best and the latest technological systems which we have as of today, and making sure that it can scale and be global one day. So that's called collective collaboration. So, you may not find like solution to all of your problems with like one given platform or one given vendor. So think creative, think outside the box, and see how you are able to achieve your requirements. And so this afternoon, I want all of you that you leave this with a challenge today, that are we just going to engage in the difficult task of the health change internally as well as externally, so that innovative digital health technologies can be implemented to improve our people's life, to improve employees' life, so that we can become future ready at workplaces. That means, are we going to take that difficult task of culture change, health change, maybe behavior change, to be able to do something which is, transformational, which is breakthrough, so that we can be future ready and we can be known as one of the best places to work at. And so this is like something sci-fi, futuristic, and I love that, one day we'll have a world where we'll be able to not only survive, but thrive and fly. And so that's it. The future of healthcare is not just about the technology, but it's about the experiences which this technology enables. With all this technology, we made sure that the human touch, the human emotions, the connections are not going away. Even with the text messaging, the employee is able to, get that empathy, get that sympathy from our physicians. With this digital medicine, we have that live, personalized chat with our other medical professionals, workers on this side. So, we thought about the chat bots and, AI based, which automated answers and everything. But we realized, we'll lose that human touch. So why not just have like our medical staff members to respond to the queries of our employees real time, from wherever they are. So that really brings that unity, that strengthens the ecosystem and feels that, okay, that human touch is still there despite all these amazing platforms which we are able to use today. So thank you very much. And I hope that I answer, this is what you were looking for, and I'm happy to take questions.
Thank you, Mr. Mehta. That was a very comprehensive presentation. Can we stop the share screen?
Sure, yes.
Well, so with that, I keep it open to all our attendees. Please key in your questions into the Q&A box. I already see some questions coming in. And before I take that, I too have some questions. So sure. I'll go with that first, and I give our participants also some time to key in some more questions. So a great presentation. I think this is definitely the need of the hour for companies to consciously ponder upon when it comes to taking healthcare, integrating it within, what we plan in within our organization with our aim and our vision for our organization or our employees. And of course, all of this has a direct impact on the productivity levels, right? So it's like the employee and the organizations grow together. That's how we look at it. So from the presentation, one thing that came to my mind, Mr. Mehta, what are the additional, investments that companies would have to incur to adopt these healthcare technologies at their workplace? If you could, just talk about that.
Sure. That's a great question. All of this, putting this robust digital health systems at workplaces is not, I would say, is not cheap, right? It's not like just spend like 10 grand and it will get done. It would really requires like a 5-year, 7-year long-term vision, right? Where you are not just selling what you will get in the form of return on investment today or tomorrow, unlike stock market. It's like you are investing this money for your employees. So you have to really seek your decision making that, okay, whatever I'm investing today, let's say 1x, will result into 5x, not maybe monetarily or financially, but in terms of overall collective outcome. So what we did is we put together our proposals. We sought after all the cost analysis from both our HR team, the IT team, as well as the vendors which we started working with. And then we saw, okay, that this is the X amount to do 100%, let's say, in ideal case scenario, right? So then we started breaking down. So we want this, right? But we don't have this much budget to do it. Fortunately, we were able to do it before COVID-19. So that's another section, but I'll just share how we did it, and maybe that gives some inspiration and some perspective to people who are watching this live this afternoon. So we did that, and then we went to our employees, right? Rather than me being futuristic and everything, that's good. But unless we meet the demands of the actual end user, all things will be just, will deploy, will implement. But if no one uses it, it's just complete waste of time, resources, and capital. So what we did is we created like customized surveys. We send it out to our employees. We asked them, hey, if we build something like this, we didn't tell that this is coming as a part of the project or as a part of the budget. But we said, if this is something like coming, if we implement, will you use it? That was like the first question. And from there, we started asking the questions, hey, what are out of this like 7 things, what are the top 3 things you would like? And we started collecting those responses, and we saw that out of like 100x, 100%, which we wanted to do it, which would cost like the total X amount, we realized employees only want 40% of that to begin with. So why to spend and why to work on all of that? Let's just do this. Let's implement that for the next 6 months, roll it out, in the soft launch with like 1 office, 1 site location, monitor that for about a week, then launch it to other site, other location, customize a little bit if it is an industry versus a corporate office versus an offshore agency, so on and so forth. And we started doing that. So over the past like 1 year, we have just rolled out 40% of the capabilities of what we have. Still 60% is way to go for us, right? And by doing this, now I can go to my senior management, my promoters and everyone, and say, hey, thank you for approving all of that fund and the capital for us to deploy this, but I've only used 0.4x of that. And I'll show you the return on investment over the next 18 months. And then we'll add 20%, then we'll add 20%, so on and so forth. So starting out is the key, rather than thinking, okay, if I want to deploy this is like X amount, and I don't have the bandwidth nor the capital to do it. So that is one of the ways you are able to do it.
In fact, I also had a question in mind that what if someone has to start from ground zero? How do they get started? So I think you've already answered, that in this, that how did you go around with, getting the entire thing started? How do you budget? But I'm sure also when we talk about, putting in investments, when we invest into something, we also look at the ROI. So the whole, savings that is going to result into, or the recurring costs that these can result into in the long term. So if you can also add a little in that if we invest, what are the savings or recurring costs that these could result into in the long term?
Sure. So I'll say, for most of our employees, they had like the gym membership, right? That they will go to like other places and like work out. So now instead of like working out over there, they are able to work out at our office gyms, right? So that's the savings for them, our employees. So that is like real savings. They love it. They can. Of course, we have the cap that they have to use the gym either before working hours or after working hours, not during working hours, just to have that fine balance. That's like on the employee savings, like simple. And the other type of savings for the corporate or for the employer is like, direct savings is with respect to our health insurance provider, right? So we have the group employees for 10,000 employees, 10,000 plus employees across Pan India. And we work with like different health insurance providers. So we receive different pricing and quotations. So over the last like 12 months, we had like this X amount, and now that has gone to like 0.85x. Right. So you can see that now that 0.15x is already the saving, because our health insurance provider saw that the employer itself is doing so many activities that the chances of those employees getting sick and getting hospitalized will decrease. Right. So then I can also work on my premium. Still, I will make a profit at the end of 12 months working with Adani. The second thing is we do proactive tracking of our employees. Back then, before all of these systems and processes, an employee or the family member will get hospitalized, right? And after 1 day or 2 days after, doing the surgery and everything, we'll get a call from the employee. Hey, I had this, I couldn't come to the office. I'm just notifying you that this happened. And then because of that, what will happen is if something could be avoided, not just like in terms of the financial wise, but in terms of the surgery or the treatment wise, was already done, right? So, we then have to like pay that, our insurance company have to pay to the hospital for the reimbursement and for the treatment and for the medical charges. So now what happens is, the moment an employee is about to hospitalize, we get that notification. We are working towards building that robust systems that employee is able to notify through their fingertip. So what happens is an employee will consult with a super specialist or our specialist on site, and together, they become the referring, recommending, triage physician. Of course, we'll send that hospital still to the hospital, but in a proper manner, where then we'll figure out, okay, what is essential, what is emergency right now to be done, what can be evolved and changed with the lifestyle intervention, like after the surgery or after the treatment, and what can be avoided, right? So by breaking this and like putting all the things together rather than just focusing on the cure, more focusing on the entire perspective, the entire, the employee's health, now we are able to save cost and also increase and improve employees' health. So that is another cost savings which we have. And then the third thing is by doing all of this, right, by having dietitians on site, if an employee wants to reduce weight or employee is having like fever or something like that, they get all the medications and everything directly at our offices. So days are gone when the HR will get a call from the HR or the boss of that employee, hey, this guy is sick, he or she will not come for the half day, and then they will come in the afternoon, or they were in the office but they were feeling sleepy or like having fever, so they left, right? So we do that tier 1 intervention on site. So what happens is an employee after like 30 minutes, 40 minutes starts feeling okay, starts feeling well, and they go back working, right? We never say that, hey, if you want to take the day off, completely fine, that's completely fine. But now employees are saying, okay, why to take a day off when I'm just feeling better with that tier 1 clinical intervention, and of course feeling that mental safety, that if something happens, this group, the healthcare team is there internally to take care of them, right? So that is another form of saving. So those kind of savings are coming together. Of course, we are calculating both quantitatively, because at the end of the day, I do have to report to like our finance team and, to show the expenses, to show kind of the, hidden, like I wouldn't say saving hidden costs, but the cost which we are able to save. And the project is more about cost savings and employee efficiency rather than what ROI will I be able to generate. Because at the end of the day, this is a service. We are providing this at no cost to our employees as a part of their employee benefit. But, after 3 years, I can say, hey, we spent that 0.4x, remember, right? So now in terms of the cost savings, I have like 0.6x. So we saved that 0.2x. So give me that money and I'll deploy more tools. I'll deploy more platforms. So that's the goal.
Right. And who monitors all this data? So what if a firm does not have a healthcare cell? So who actually, would monitor all this data that comes in?
Sure. So at Adani, we are the healthcare team monitoring all this data, right? But for the companies where they may not have like the healthcare team, or they're putting the healthcare team in place, they can have one of their HR person to monitor this data, who may have like the medical experience, or who may want to learn more about the medical aspect. Every group or every company has one liaison who will be working with their insurance network, insurance provider, right? So that person knows a lot more about, okay, what are the hospital charges, what is copay, whether it's cashless facility, so on and so forth. So he or she might be able to coordinate this data. And then last but not the least, you can always hire like a medical coordinator or a medical assistant, someone who has like some clinical background, not necessarily like, you don't have to be a doctor to monitor, analyze this data, right? And so you can recruit that person who can intervene and make sure that this is provided in the coordinated fashion.
And this is my last question before I go to the Q&As that are coming from my attendees. But from a challenge perspective, could data security be, one challenge? And from your experience and examples that you've, given us in your presentation, how does one safeguard data?
Sure, that's a great question. All this technologies is like good and great, but if it doesn't have like, for example, very simple 256-bit encryption, or it's not HIPAA compliant according to the US standards, or it is not like secured remotely on cloud and having the backup copy on the local server in case of some disaster, then it can become very challenging, very risky. People's job are sometimes on the line for that, especially the information tech team, because one of their goals is to make sure that we are able to deploy a tool or collect the employees' data in a way that it doesn't get leaked into the dark web or someone doesn't get a hold of it, right? Because then it will be a big rather than focusing on the creative aspect, boosting the employee morale, like now the employees will be even more afraid of like sharing their, personal confidential medical history, or, talking about their hospitalization visit, or if they had any particular case in the past, right? Or if they have like, some serious, critically ill, terminal illnesses like cancer or late stage, tuberculosis, so on and so forth. So we make sure that we protect the employees' data to the best extent possible. We follow all the standard norms according to the cybersecurity. And, when we evaluated those vendors, we didn't select one or the other, despite having like nice dashboard and cool and sexy look, because we wanted to make sure that we are not compromising on the security. So when I talk about that, you have to create your own requirements even before you scope out and invest your time, resources, and capital. You have to find out, okay, what is more essential for you, to look good or to be safe, right? And we always choose to be safe first, and then focus on the UI UX, which is like the user interface, user design, like as we move along.
Absolutely. And with that, I go straight to the Q&A box.
Okay.
Let us just go through the comments that have come in. So Mr. Mishra says, very good presentation. Mr. Deepak Sharma says, most important factor. What is the most important factor for telemedicine success? And what is the right process to get started?
Sure. So, if someone would have talked about telemedicine before COVID-19, most of us would be like, hey, what is telemedicine, right? But now it has completely changed. Now everyone knows what is telemedicine. So in terms of like the most important factor for the telemedicine success is deployment and usage, right? As I mentioned that there are over 97,000 apps on the App Store related to health and fitness, walking, tracking your vitals, tracking your heart rate, so on and so forth, tracking your sleep even, but less than 25% physicians even use those applications, right? So when you even like take it to the next level as to like common consumers or even your employees who are already like bogged down with like the 9 to 5 like projects, proposals, deadlines, submissions, conference meetings, so on and so forth, it's the last thing that they want to do something more on the top of it, right? So always like taking your end users perspective and feedback as to like what and how that they would love to use something if you're going to spend again the time, resources, and capital, and make sure that you are able to meet that, right? It's about like sometimes we want to make an apple, but we end up making an orange and it doesn't work. And then that there's always like the constant battle. Hey, we did all of that, but our employees didn't use it. And then our employees will be like, they did something, but we didn't like it. So why to do it? Do it that way. It's not like you are like trying to sell it to your customers. This is not like customer and business. This is like you are doing something for your own employees. You are like one team, one solution, one roof. So that like the commonality, culture must be created first before like even thinking about deploying any telemedicine solution. And then the second thing, what is the right process to start is, first you have to identify, what type of capital you are looking to deploy. The second thing about is that, is that the right fit for you, right? Sometimes it is better to outsource telemedicine to one company who will take care of your employees, right? Make sure that they have secured cybersecurity protocols in place. And then you pay a monthly fee, and then one person from your group or one person from your company monitor, supervise, make sure that he's managing everything or she's managing everything, right? That might be even more cost effective and also like time sensitive. That means you can deploy even at a faster pace, considering that you only have like 100, 200, 300, 400 employees, right? So you have to see that whether that would be a good fit to do it. For Adani, we cannot just outsource like 10,000 plus employees data to a third party vendor. Okay. We want to make sure that we keep our employees data confidential, private, secure. So for us to outsource anything is not possible. So that is like the demarcation which you have to make. The other thing you have to see, okay, whether telemedicine is the right fit for you. If you're working, if your group is working for, I don't want to like classify, but at the same time, from just the business viewpoint, if your employees are like 80% of your employees are 55 plus, 60 plus, chances are that they may not use telemedicine solution. They would rather still like want to go to a doctor, spend 20 minutes in the waiting room, because they're trained. It's the culture, they want the clinical care to be availed in that face-to-face setting and spend half a day of their life, right? To avail, like, want to get one pill for like one common symptom which they had. Okay. So you have to realize that at Adani, our median age of employees now is 34. That means most of our employees are like now like young generation, of course supervised by the experienced people, but they are tech savvy. We are seeing a constant trend that they have been using a lot of technological solutions. So for us, telemedicine was a good fit because we knew that they will start using it, start implementing it, and we'll start seeing the outcome, right? And then the third thing, the last thing is that what about the connectivity, right? If your business, and because of COVID-19, I have to state that if your business have to let go of 5 employees so that you can build telemedicine solution and show how good you are, wait a minute, you should rather think that would that be a good strategy to do it, or you should wait, get back into the business, provide the care, provide the healthcare the way you are doing it right now, generate some profit, increase your bottom line, and then use that extra buffer cash to do the telemedicine. So those are some of the processes which you have to keep in mind.
Ambika Nandan Misra says, future for pharma industries and education and role of RI in future.
So future of pharma industries is very important. Pharma is constantly, is pushing their drugs, their treatment solutions to more digital, every single day. Is like they are now, there is a new concept called digital therapeutics. That means along with a doctor prescribing a medication, the physical pill or an injection, now the doctor is also prescribing an app which a patient has to download and use it for the next 60 to 90 days as a part of the treatment solution or as a part of their, clinical protocols. So pharma is constantly pushing that how the actual drug can linked with a digital solution so that there is increased efficacy. That means a drug will result into a better outcome for the patient. A patient will get better soon, and there'll be less side effects. It will increase in the medication adherence. That means a patient will take that pill or that tablet or that capsule every single day at a given time by that doctor, and then notify that through the app so that a doctor is tracking on a continual basis, rather than a patient coming after 2 months and saying to a doctor, hey, I took the pill for like 10 days and then after that I forgot, or, I misplaced my medications. So those kind of things the pharmaceutical companies are doing on the top of course, doing that R&D, working on the vaccine trials and so on and so forth. And in terms of the education, I believe that you're talking maybe about the patient education or the medical education. Yes, so for both, it is very critical. Nowadays, if you are as I shared in my slides, experiential education is the need of the time. That means that days are gone when you will like just tell like someone, hey, read this book and it will have a solution for that. Show me how, show me where, and show me quickly, directly, like within the next 20 seconds, how it will impact me. What's the outcome? What's the benefit for me? So that type of education has to be created, a simulated environment where the doctor can perform the surgery before actually performing a surgery on the real patient, a 3D printed skull or the brain where a doctor can learn rather than just reading in the books. So that type of education will improve the outcomes for the patient and will improve the clinical rating for the doctors. And then your next question in terms of the role of RI in future. So Ambika Nandan, if you can share what is RI, then I can, talk further on that. Sorry, I don't know what RI means.
Yes. So till then we go to our next question, which is from Deepak Sharma, that what impact would be on healthcare post-COVID? So what would the impact of, how would the whole post-COVID scenario impact the healthcare sector?
I say it like COVID has already impacted healthcare, not in a good way. but in literally like the worst possible way. Now the doctors, nurses are coming out to be like the COVID-19 positive. There is less talented medical professionals who want to go and treat our friends, our family members who are going through this life crisis, this pandemic. So healthcare is taking a toll. And that's one on the resources on the men or the women's side. The second one in terms of the capacity, we are running out of the capacity in terms of the beds, in terms of the ventilators, and so on and so forth. So that's the another challenge which we are facing as of today. The third challenge is about the finding the true information, which is not biased, which is factual, clinically validated information, is very difficult. You will hear one thing by one news channel, another thing by another news channel, and you think that healthcare is not good. And it may be the case, but you don't know what is going on, what is the ground reality. So for us, the people who are outside the hospital today, the only goal for us is to stay healthy, improve our immunity, and have a great mindset to avoid all the noise, avoid all the media news and everything, so that if we stay healthy, then it will be a great benefit for the healthcare workers who are already struggling to meet their ends, to make sure that they are able to take good care of the patients who are already in the hospital. So that's one. And then the second one is how to create support structure, by making sure, for example, just giving up, our professional example at Adani, by making sure that our 10,000 employees will not utilize any of the beds in the medical, hospital, unless it is an emergency. That's a great asset for us, right? Now, we are making sure that we are supporting the healthcare system of the country, so that our employees, like without an informed knowledge, without an actual need, they are not just like going and like, doing that afternoon walk. Hey, I thought that I was ill and I had like 2 coughs and I had like a slight fever. Let me go and visit the doctor. No, for that you have telemedicine. For that you have one-on-one consult with the physicians on site. So that way, you as an employer, it is also an important task for us to make sure that we support our healthcare infrastructure, not maybe with financially or with any other things, but keeping our employees, keeping our family outside that ecosystem.
Right. We have a question from Ashok Puri. I think
Okay.
this has already been answered, but just in case you want to add something else, that companies will have to take care of healthcare data security, which I think we've already covered. Will that not be another liability?
Sure. I would say one thing, this is like a statement from Spider-Man movie, and it states, with great power comes great responsibility. So, one thing I would share with you, that when you start a company, or when you're working as a manager in a company, aren't you taking a liability of your employees, of your colleagues, of the company, if you are the founder or if you are the promoter? So along with that, you are taking one more liability. Running away from a liability will not be a good morale, considering where we are today. Rather, putting the best measures which are available today to make sure that you decrease your liability from like high risk to the very low risk will be essential. And that is how you can avoid that, and rather think positively, rather think that, okay, I know that, because when I proposed this project at Adani, I was taking a lot of liability. And hey, I'm like just like the fresh kid who just started at Adani after like working for other ventures and everything. So why would someone believe in me? So I said that, allow me, give me a shot. And this is how I'll reduce the liability. This is how I will increase the productivity. This is how I'll reduce the cost. This is how I will improve the employee's health, right? Both qualitatively and quantitatively. And so after having a careful, informed decision, they thought, okay, he is like looking from the holistic viewpoint and making sure that it will be the best possible. So, and that is like the long-term liability. And on the short term, I would say in terms of the liability, have a daily monitoring, have someone who monitors the data daily, have someone who cross-check that. What we do like on the phone purpose is that we have one of our IT person who can go and like crack other code, right? So I challenge him, hey, go and like try to steal the data from our cloud. And he's not able to do it. So I think that if my own colleague who is who has that expertise is not able to crack the code in terms of like stealing the employee's health information, that means we are making sure that we are putting all the protocols and all the standard processes in place to make sure. And last but not the least, if something like this happen, the only thing you can do is you can tell your employees, hey, we are sorry, we did this with the best intent to provide you with an effective health outcome, not only for you, but your families, and to keep you out of the hospital systems so that you can have a meaningful, happy and healthier life. We made a mistake and we'll do our best to overcome this.
Perfect. So what I'm going to do is we'll quickly take maybe just a last question because we need to bring this session to a closure as well.
Sure.
So I'm just going through the chat box because I see some comments have come in there as well. Okay, the telemedicine one we've already covered. Okay. I'm a dentist with 10 years of clinical experience now. I want to know, is there any opportunities to work in digital healthcare systems? This is from Lalita Donapati.
Sure. Thank you for asking that question. That is a wonderful question. People like you have that like 10 plus years of experience in a particular domain. For example, your domain is like dental industry. There is definitely a lot of scope to either work in digital health or to implement digital health at your practice, right? Where you see people with dental related challenges, right? Or conditions. So number one is you can have an online scheduling, very simple, I know, but it can create a lot of productive time for you, because I know that how many doctors are struggling that they will schedule like 20 patients for a day and only 10 will show up, right? And out of that 10, 5 of them will even show like half an hour, 45 minutes late after their scheduled appointments. So digital health doesn't have to be like super fancy or like super futuristic. I know that, I love that. But to start with, you can have a simple scheduling software where you are able to do that, where that patient gets like notification 1 hour before their appointment, when someone like makes sure that they arrive on time, proper directions are given to them. So you get that patient into your practice, like your dental practice. Another tool you can use it is to provide patient education in digital media. Through digital medium. That means, let's say if I had like the wisdom tooth and you removed it, right? After that, I'll have more than 100 questions which I want to ask you, right? And every visit, I'll be like, hey doc, like I'm still having the pain, or like, can I eat this, or can I have like the juice, or can I have sugar, all that stuff, right? So you can create like a compendium or a library where you have all these questions, like commonly asked, frequently asked questions, and you can put it together, and then it's under different subjects like wisdom tooth, and you are the domain expert, right? So you can classify that, and then based on that, whenever a patient comes, you can say, hey, here's the link, read everything or watch this 10 videos, and I'm pretty sure that they will stop calling you, right? And I'm not telling that avoid your patients, but make sure that your expertise, your time is well spent solving challenging that I talked about the Maslow's hierarchy of need, the self-actualization level, right? Where you have to think creatively, not only for you, but for your entire organization and eventually for the world, where how you can make this world a better place. And I know it's a cliche, but that's how, as like the expert, the domain expert, we have to think. So how can we automate some of the things? And then the third thing is, you can have an electronic dental record, right? There are tools and the softwares which are out there, and you can connect with me afterwards and I can share with you. Again, I'm not affiliated with any of these companies, right? And what it does is all the way from scheduling, all the way to the checkout, everything is done through that platform, including collection of your payments, right? So now you are avoiding all the paperwork, you're not worried about files getting misplaced. talking about the liability, right? Let's say your building burns out, all your patient's data record is gone. Boom, right? Decreasing that liability and making sure that you can track the employee visits, and then it gives you the AI-based pattern analysis, right? Whether there is the increase in the tooth decay, whether the patient is getting normal, whether the drug has any side effects, right? Now you have like that resources of information at your desktop or at your laptop, and then through that you can provide a personalized care to your patients, and then for sure your patients will love you.
So with that, we bring this session to an end. We've already crossed our time, so we'll end that. But thank you so much, Mr. Neel Mehta, for all your time and for all the information sharing. I think that's the whole intention of IDEX Healthcare as well. We want to create this platform for information sharing that could help the sector grow and everybody in the sector, all stakeholders grow. Thank you all our attendees for joining us today. We will keep all of you updated with all our sessions to come. So stay tuned with us and dive into all our webinars. Till then, yes, the time is tough, but the time has a lot of opportunities. All we need to do is explore it positively, optimistically, and with a smile. So take care, stay safe, and we will see you soon on our next webinar. Thank you so much.
Thank you.
Thank you.